Hi, my name is Eleni Gavriilaki from Thessaloniki, Greece. We are pleased to present our poster from EHA 2024 about the Association of Hemophilia and Fracture Risk Systematic Review and Meta-Analysis. Briefly, we know that bone mass density is reduced in patients with hemophilia, and there is also an increased incidence of osteoporosis risk factors, which may be implicated by the loss of the protective effects of factor 8 or factor 9 and thrombin on the bones. However, the exact association between hemophilia and fracture risk has not been clarified yet. Therefore, we organized this systematic review of observational studies. We excluded studies that did not have a control group from the meta-analysis, and we also excluded studies that did not report on fracture incidence, drugs or diseases related to secondary osteoporosis, animal studies, and studies written in non-English language. And this is our search strategy. This table summarizes our findings of the systematic review in patients with hemophilia A or hemophilia B. And with red, we see the studies that were finally included in the meta-analysis. In total, we studied 13,251 patients, mostly with hemophilia A, and the fracture data were recorded from interviews in 9 studies, from medical database in 4 studies, and also from the DEXA scan in 1 study. The prevalence of fractures in patients with hemophilia was 5.7%, and the prevalence of fractures in control groups was 0.9%. This can be translated into this forest plot of the studies shown in the meta-analysis, highlighting, of course, that the prevalence of fractures in hemophilia is higher than the control group. And this was statistically significant and shown here by the numbers. And we performed a sensitivity analysis after excluding a study performed only in pediatric populations. Despite the limitations of our study, which were the small number of patients, the high level of heterogeneity due to the studies in the literature, the lack of data to compare fracture incidence according to their location, and the lack of data to compare fracture incidence in patients on or off prophylactic treatment, we believe that this is an important step in the literature towards understanding the association of hemophilia with increased fracture risk. And we plan further studies to reveal the pathophysiology and also to reveal the incidence in certain hemophilic populations. Thank you very much for your attention.